Stop for a moment and imagine this. You check your blood pressure monitor, and the numbers are higher than they were last month. Maybe your doctor mentioned medication. Maybe you're already taking pills and wondering if you'll need more. But what if I told you something surprising? Many people are able to lower their blood pressure naturally by changing just a few simple daily habits. No complicated routines, no expensive supplements, and no extreme diets. I'm going to show you 7 natural tricks doctors often recommend to help bring blood pressure down safely. Some of these methods can begin working within hours, and one of them has been shown in studies to reduce systolic blood pressure by as much as 11 points. But here's the surprising part. One of the most powerful things you can do to lower blood pressure is something you may already be doing every single day, just in the wrong way. And fixing it could dramatically reduce the strain on your heart. Stay with me, because by the end of this video, you'll understand what habits quietly raise your blood pressure and the simple adjustments that can help bring it down naturally without relying only on medication. Type "I'm taking control" in the comments if you believe your health should never depend on pills alone. Now, let's begin. If you've been struggling with high blood pressure, I want you to hear this first. You are not alone, and you are not failing your health. High blood pressure is one of the most common health conditions in the world, especially as we get older. Millions of people wake up every day worried about their numbers going up, their medications increasing, or the long-term risks to their heart and brain. And the frustrating part is this. Many people feel like they're doing everything right. They try to eat better, they try to exercise, they cut down on salt, yet the numbers on the monitors still seem stubborn. But here's what many people don't realize. Blood pressure isn't controlled by just one factor. It's influenced by dozens of small daily habits, some obvious and some surprisingly hidden. Tiny things you do every day can quietly raise or lower the pressure inside your arteries. The good news is that when you start adjusting those habits the right way, your body can respond faster than you might expect. And that's exactly what we're going to talk about next. My name is Dr. Andrew Bennett, and I'm a preventative cardiologist who has spent more than 2 decades studying heart health and treating patients with hypertension. Over the years, I've worked with thousands of people who believed their rising blood pressure meant they had no choice but to depend entirely on medication for the rest of their lives. Now, let me be very clear. Blood pressure medications can be life-saving, and for many people, they are absolutely necessary. But what most patients are never told is that daily habits often determine how high that number climbs in the first place. I've seen patients reduce their blood pressure significantly, not by doing anything extreme, but by adjusting a few simple behaviors that influence the way their blood vessels, kidneys, and nervous system regulate pressure. And the science behind these habits is stronger than most people realize. Many of them are backed by large clinical studies showing measurable drops in blood pressure when these strategies are used consistently. That's why today I want to walk you through 7 natural tricks doctors often recommend to help support healthy blood pressure. Some are surprisingly simple. Some are completely overlooked. And one of them might be the most powerful change you can start today. In the next few minutes, you're going to discover a simple morning habit that can reduce blood pressure by improving circulation within minutes. The overlooked mineral many people are missing that helps blood vessels relax naturally. A walking strategy shown in studies to lower blood pressure by several points. A breathing technique doctors use to calm the nervous system and reduce pressure inside the arteries. And the N1 habit that quietly raises blood pressure every single day, one that millions of people do without realizing the strain it puts on their heart. But before we get into the first strategy, if you believe people deserve simple, science-based health information without confusion or fear, type "I choose heart health" in the comments. And if you want more practical health guides like this, make sure you subscribe and join this community of people who are taking control of their health naturally. Now, let's begin the countdown. Let's start the countdown with strategy number 7. Number 7. The morning hydration reset. Many people wake up slightly dehydrated. And dehydration can quietly raise blood pressure. When your body lacks enough fluids, your blood becomes slightly thicker, and your blood vessels may constrict to maintain circulation. This increases the pressure inside your arteries. Research published in the Journal of Human Hypertension has shown that proper hydration helps maintain healthier vascular function and circulation. Simple action. Within the first 30 minutes of waking up, drink a large glass of water. About 16 to 20 ounces is ideal. This helps restore blood volume, improves circulation, and gently supports your cardiovascular system for the day. Now let's move to the next strategy. Number 6, the potassium balance trick. Most people focus only on reducing sodium, but they forget the other half of the equation, potassium. Potassium helps your kidneys flush excess sodium out of the body and allows your blood vessels to relax and widen, which lowers pressure inside the arteries. According to research from the American Heart Association, increasing potassium intake can significantly improve blood pressure control. Simple action. Add potassium-rich foods to your daily meals, such as bananas, spinach, avocados, sweet potatoes, beans, and even a modest increase in potassium intake can make a measurable difference over time. Number 5, the 10-minute walking habit. One of the most powerful natural ways to reduce blood pressure is movement, especially walking. A study published in Hypertension, the Journal of the American Heart Association, found that regular walking programs can reduce systolic blood pressure by 4 to 9 points. Walking works because it improves blood vessel flexibility and helps your heart pump more efficiently. Simple action? Take a 10-minute walk 30 minutes after every meals, especially dinner. This helps regulate blood pressure, improve circulation, and also helps stabilize blood sugar levels. Now, we're getting into strategies that influence something even more powerful, your nervous system. Number 4, the deep breathing method. Your blood pressure is strongly influenced by your autonomic nervous system. When your body stays in a constant state of stress, the sympathetic nervous system keeps your blood vessels slightly constricted. Slow breathing activates the parasympathetic system, which relaxes blood vessels and lowers heart rate. Clinical studies have shown that slow breathing exercises can reduce systolic blood pressure by about 5 points. Simple action. Try this simple pattern. Inhale slowly through your nose for 4 seconds. Hold for 2 seconds. Exhale slowly for 6 seconds. Repeat this for 5 minutes daily, especially in the evening. The hidden salt sources most people miss. Even people who avoid the salt shaker may still be consuming excess sodium without realizing it. Nearly 70% of dietary sodium comes from processed foods. Common hidden sources include bread, canned soups, processed meats, salad dressings, frozen meals. Excess sodium causes the body to retain fluid, increasing blood volume and raising blood pressure. Simple action. Start checking nutrition labels and aim for less than 2,300 milligrams of sodium per day or lower if recommended by your doctor. Number 2, the sleep pressure connection. Poor sleep doesn't just make you tired, it can also raise blood pressure. During deep sleep, your blood pressure normally drops by 10 to 20%, giving your cardiovascular system time to recover. But when sleep is short or fragmented, that recovery period disappears. Studies from the National Institutes of Health show that people who sleep fewer than 6 hours per night have a significantly higher risk of hypertension. Simple action. Aim for 7 to 8 hours of consistent sleep and try to keep a regular bedtime. Your heart depends on that nightly recovery window. Before we reveal strategy number 1, the most powerful natural trick on this list, if this video is helping you understand your blood pressure better, take a moment to like this video and share it with someone who might need it. You never know who in your family could benefit from learning these simple habits. Now let's talk about the number one natural trick doctors often recommend. Number 1. The nitric oxide booster, the most powerful natural trick. Now we arrive at strategy number 1, the habit that can have one of the most immediate effects on blood vessel health. It revolves around the molecule your body produces naturally called nitric oxide. Nitric oxide acts like a signal that tells your blood vessels to relax and widen. When your arteries widen, blood flows more easily and the pressure inside those vessels drops. The problem is that as we age, our bodies produce less nitric oxide, and our blood vessels gradually become stiffer and narrower. But research has shown that certain foods can naturally boost nitric oxide production. One of the most powerful examples is dietary nitrates, which are found in foods like beets, spinach, arugula, lettuce, celery. Studies published in the journal Hypertension found that drinking beetroot juice can reduce systolic blood pressure by about 4 to 10 points within hours. This happens because the nitrates in these foods are converted into nitric oxide inside the body, helping the arteries relax and improving circulation. Simple action. Add one nitric oxide boosting food to your day. This could be a small glass of beet juice, a spinach salad with lunch, or a handful of arugula added to your meals. Small daily habits like this can help support healthier blood vessel function over time. Now, let's bring everything together into a simple daily plan you can start today. Here's your natural blood pressure support routine. Morning. Drink a large glass of water after waking up. Include potassium-rich foods like fruit or leafy greens. During the day, add nitric oxide-boosting vegetables like spinach or beets. Pay attention to sodium levels in processed foods. After meals, take a 10-minute walk to support circulation. Evening, practice 5 minutes of slow breathing to relax your nervous system. Aim for 7 to 8 hours of consistent sleep. You don't have to implement everything at once. Even adopting 2 or 3 of these habits can begin improving blood pressure over time. The key is consistency, not perfection. Remember this. Your blood pressure is not controlled by just one pill or one doctor's visit. It is influenced by hundreds of small signals your body receives every day, from the food you eat to the way you move, breathe, and sleep. When you start changing those signals, your body often responds faster than you expect. You now have 7 powerful natural strategies that can support healthier blood pressure and reduce the strain on your heart. And that means you're no longer just reacting to high numbers, you're actively taking control of your cardiovascular health. Before you go, remember this. The habits we talked about today may seem simple, but they can quietly shape what your heart looks like 5, 10, even 20 years from now. So if you want more practical, science-based health strategies that help you stay strong, independent, and in control of your health, make sure you subscribe to the channel. And share this video with someone you care about, because sometimes the smallest habit changes can protect the heart for years to come.